So we are here to talk about health, home as a foundation, discussing the relationship between housing and health and how you build healthy communities literally by building them. I wanted to start by asking this question to Alice. Alice, what is the relationship between housing and health, and how do you conceptualize it from the perspective of a policymaker?
So from the standpoint of policy in the city of Baltimore, we look at the intersection of health and housing as a critical component to how we stabilize neighborhoods and how we move forward. Everything from economics, jobs, housing, health, they're all interconnected in some way. My division, we oversee the Division of Lead Hazard Reduction, Office of Home Ownership, Weatherization Services, the Office of Rehabilitation Services. I also do summer food work within Baltimore Energy Challenge, and all of those components tied together support a healthy home, and also with the health of the occupants inside that home. I also look at the component of not just physical health, but mental health. One of the things that often I think sometimes gets forgotten is that we have some issues in Baltimore in terms of crime, poverty, but some of those things can start and be addressed with what happens in the home, not only around physical health, but also mental health. And I think those are extremely important to look at the intersection of both of those. A child can experience childhood trauma by listening to their single mom trying to figure out how to pay their utility bill over the dinner table. An older, aging adult in the city of Baltimore can experience depression if they're having issues with their roof leaking and not knowing how to fix that and trying to figure that out. So we look at it from the city of how can we support our residents in creating an environment within their home that is healthy for them and their family, both physically and mentally.
And what kind of challenges and maybe opportunities do you see in the city? What are the biggest challenges and opportunities to the work of creating healthiness through housing?
I think one of the biggest opportunities is the fact that we have a significant number of amazing community residents and community partners, as well as nonprofit partners like Rufan and Samuel sitting here with me, that help us do this work. As city government, we can't do everything alone. We need partners sitting with us at the table. We need partners in the community. We need residents. We need to hear their voices. And I think that is one of the areas that we have the greatest opportunity here in Baltimore, is harnessing all of that energy that exists. There's a tremendous amount of work that's happening around the intersection of housing and health with partners that we have, whether or not it's with Bon Secours or Green and Healthy Homes Initiative, Civic Works, other organizations across the city. They're stepping up to the plate, and our residents are eager, and they're also eager to support the efforts as well at a community grassroots level.
Ruth Ann, I wanted to turn to you because one of the biggest challenges I think that we talk about in the media a lot, especially, is lead poisoning, lead paint. What does your organization do in terms of abating lead paint and lead poisoning, and how can we think about it as a nationwide model for creating healthy spaces?
So our organization that was founded in 1986 by 9 parents whose children were at the Hopkins Intensive Care Unit being chelated for lead poisoning came together with a vision to break the link between unhealthy housing and unhealthy children. And it's the aspiration of that that has driven a 99% reduction in childhood lead poisoning in Maryland and in Baltimore City, which is a national model. But that aspiration is really about, do we get kids in the classroom that are prepared to be able to compete at 3rd grade level reading, that are not beset by not only lead poisoning, but asthma, where they're not breathing through the night, they're spending more time in the emergency room and into the hospital rather than the classroom. And how do we look holistically? Lead is a symptom of housing condition, and housing condition as we see it in America reflects what our values are, and our values need to be on providing that trajectory and the safe home to do it. So we hire from impacted communities. We train on environmental health inspection, on lead hazard control, on how do we train judges and how do we train policymakers, and how do we engage the one thing that has driven our 27 pieces of legislation in Maryland that helped us move this forward, that compelled health commissioners like Josh Sharfstein to start to do meaningful enforcement, and that is to listen and live and be with the families who are living through this. Our goal is that, you know, Lena said earlier, public health is what we've prevented that you don't know about. If you work at our organization, if you're part of our mission, we don't want any child to know our name because we want it to have never happened to them. And the other thing that we've looked at is how do you deliver this with better government? So we have combined the look at lead poisoning, at weatherization, at asthma reduction, at caring for our seniors, giving them the ability to have mobility and safety. And by doing that, I know there's some slides on this somewhere, but by doing that, we raise the value and the wages for the workers. We save government money. We provide better care and a start. But what we really provide in that is the opportunity for health outcomes, for economic and educational outcomes, and for social outcomes. Everybody here, if we think about it, what we want is the child who can get through school and compete and graduate and go on to Hopkins or Harvard or Morehouse or where you went, right?
Good place.
Or the University of North Carolina where we both went, right? But to aspire and to be able to dream and not choke to death or not be able to read, and that's the goal.
So we do have slides. We want to show the audience on exactly what it is you do, and hopefully you can walk us through it.
So I said this is one of the better abandoned or boarded up houses that we will do. With housing condition in Baltimore can be breathtaking on both sides. But if we look at this house, it's full of lead paint hazards on the porch and on the windows. If you look to the left, you see a house that we've done.
All that peeling paint.
All that peeling paint. If it looks like alligator skin, you're in trouble, right? We need to clean it up. But there's no rails there for people to get in and out of housing. We have to have good indoor air quality. And often these are small costs, right? We can spend $1,700 doing things that reduce asthma and will prevent $250,000 of Medicaid cost over a 5-year period. So we're sealing windows, we're doing pest management, we're pulling up carpets, we're changing out windows. You see the guys in the very funny protective gear. They're not the Pillsbury Doughboys. What we care about very much is not to continue the toxic legacy of lead, and it often comes in the granules of leaded dust, which take only 3 granules of leaded dust to start to impair a child's brain and to impair their ability to read. Now, this is the outcome we want, right? And or even better, I think we still have a little roof work to do on that house. And this is all done by people who live in communities who can be trained. And I know Sam and I have talked about it a little bit, but we aspire to scale teaching these skills around environmental assessment, investigation, contracting, because these are great paying jobs. They're a pathway of opportunity. And there's nothing better for any of us to be in an environment that's not extreme heat or extreme cold or toxic, but builds to the outcome and the aspiration that Baltimore has for itself.
Now, I want you to tell me a little bit more about the community involvement just a bit later. I want to turn to Dr. Ross because I imagine lots of people in this room are wondering why a CEO of a hospital is on a panel about housing and health. Right. Can you tell me more about what Bon Secours is doing in the area, what its philosophy on public health and housing is, and how it's involved in so many different areas of healthy lifestyles and development?
Yeah, thank you for the opportunity. You know, and I'm a family physician by training, and no, I never saw myself as a landlord when I started out this pathway. But, you know, we've been talking about population health, and we've been talking about healthy communities in medicine for a number of years, and most significantly since the Affordable Care Act. But Bon Secours, you know, got into this business long before I arrived. I've only been here about 12 years. But the picture you see started really in the mid-90s. Many people this morning have talked about community engagement. And this grew out of the community engagement activity because when you asked the community at the time what their #1 priority was, they said rats and trash. Mm-hmm. The root cause for the rats and trash was the fact that you had many boarded up houses and a lot of drug activity and other things going on in those houses. So the system made a commitment really as an anchor institution to do something about what was happening in that community. So what you see here is our first what we call bond apartments, bond secure apartments. These were developed between 1995 and 2003. All told, we have 119 units, and that's from 59 different buildings that we were able to acquire. About $13 million in total development costs. And these have 1, 2, and 3 bedroom apartments. No rent subsidies. We consider these like workforce houses, so sometimes it's employees that may be in here or other community members. Income eligibility is $18,500 for a single person and then $53,000 for a family of 4. The second building you see is actually Hollins Terrace. Now, Hollins Terrace, you know, talk about repurposing, it was a school. And we were able, through 202 funds, which don't exist currently, to create the senior housing activities that we have there in that building. There's 84 units total, 1 bedroom and studio apartments for very low income elderly. And we do have some disabled that are 55 and older. And in income eligibility, you only pay 30% of your income for rent. And that's been really helpful in that population. And then I think the third slide we're going to show here is our newest activity, which is New Shiloh. Many of you, if you're from Baltimore, you're familiar with New Shiloh Baptist Church. So we've done now 2 engagements with them, developments with them. So this will be 73 units for individuals and families. The rent will range on average about $733. We think seniors will mostly want to go into these facilities, but families with children can also go into these facilities as well. There are 11 units set aside for disabled persons and 8 units for formerly homeless individuals and families. And we're actually working with Healthcare for the Homeless, Kevin Lindemuth and his team, to make sure we find the population that can go into this facility.
You mentioned earlier that Bon Secours is an anchor institution. Can you tell us more about what an anchor institution is, what it does, and how the theory of how these relate to community health and the development of healthy housing in places?
Yeah, so you heard Dr. Wynn earlier use the phrase, "We are the ones we've been waiting for." So what we as an institution established a long time ago was that this was part of our mission. And so when you looked around, we're the primary economic engine in that community. You know, we hire, the most folks from that community. And so the acceptance was that we had to be responsible for creating that future around that community, but it was done in partnership. So at the time, there was a group called Operation Reach Out Southwest, which was about 13 neighborhood associations that we partnered with to say, here are the things that we believe will make Southwest Baltimore a thriving, vibrant community over the next 20, 30 years. And so being the anchor means that you take the steps, you have the courage, you do the advocacy to bring other partners and collaborators into the picture in order to accomplish these things. Because as we all have said, none of us have been able to do this by ourselves. And so some of you have heard me speak. I'll refer to an old African proverb that says, if you want to go fast, you go alone. If you want to go far, you go together. And to get to scale, we're going to have to go far, and we're going to have to go together.
I wanted to turn to you, Alice. That was great. I need to put that in my notebook. But I do want to turn to you, Alice. We've written a lot about in the pages of The Atlantic about the history in Baltimore, especially, of redlining, racial disparities. Do you find that these sort of structural holdovers, do they affect your work and the racial outcomes of healthy housing in the area?
They do affect our work. I think that it is one of the, I don't want to say hardest pieces, but it is a piece that we have to look at and be able to kind of accept what our past is in order to move forward and have that level of acceptance and understanding of where we have been, what the ramifications of our past are, where has that put us today, and how can we make changes to move forward. So the city of Baltimore, in terms of looking at different things, there's programs within the Department of Planning and Sustainability. We've started to incorporate an equity lens to the work that we do. Other agencies across the city are taking that on board, looking at how we incorporate equity in terms of moving things forward, and looking at the communities that have had a history of disenfranchised investment in terms of how they've been feeling, and what can we do to shift that, and how can we increase investment in an equitable way in those cities, that both in those neighborhoods within the city that get at, especially the work that I do within the Department of Housing and Community Development around preservation of homes, reduction of vacant land, and also supporting the community in terms of what they want and hearing the voices that they have and where is that coming from. Also providing the opportunity for jobs and economic. That is one thing that we did when we were looking at different things with our procurement process, and even with the contractors that we utilize with weatherization and lead hazard reduction and Office of Rehabilitation in terms of local hiring, as well as job training. So through those programs, supporting organizations like Green and Healthy Homes Initiative, as well as Civic Works, that have those job training components that are bringing people from the communities to support that work. So I think it's an extremely important thing for us to look at, and we are taking those steps to see how can we increase equity across the city and make changes in terms of where we look at investment for the future.
I want the audience to get your questions ready, but we have one more I want to ask Ruth Ann about. We discussed backstage how you were getting people in the communities. I think this is fascinating. You have people from the communities working on these projects. You're paying people salaries to go back and clean up their own communities. How do you, what does it say about long-term sustainability, about the project you're engaged in, and that kind of philosophy?
Well, I just want to do one thing on your last question really quick, which is we have to break the conscious and unconscious collusion of the systemic racism that led to this, right? And all of the things of that were done, and we have to have the standards across and have the courage and the belief and the support for the standards in every community that we would aspire for the best communities. And we talked about the 99% reduction in childhood lead poisoning. Duke University did a study. I know we have trouble with that because we were from Chapel Hill. But they did a study that said we returned back to the Maryland economy $44 billion. But that $44 billion did not get redirected to the people who had been impacted for generations, and that's what we must do. That if we create savings, if we do this. But one of the things we're looking to do to try to sustain this is to compel, places like Hopkins and the University of Maryland and every nonprofit hospital in the country to take their hospital community benefit funds that are mandated by the IRS to be invested in the community, to put it early on and to keep kids out of the emergency room, keep them out of the hospital. But we're also breaking new ground to say Medicaid managed care across the country can borrow money, help scale, help to reduce asthma, lead poisoning falls, and utilize those savings created by doing this work up front so they can have a good business model, but we will invest in health and we will bring money and jobs to communities. The goal is the outcome, and we want people to live in this community, but no one should live in it unless we are committed to that fairness of we talk about health equity and we talk about racial equity. We have to also translate that into who's at the table, how are the decisions being made, and who's being hired to do the work.
I feel like I've just filled my notebook up with awesome quotes from everyone. Let's go for the audience.
Hello, my name is Sarah Polk. I'm a director of the Center for Health and Opportunity for Latinos at Hopkins and also a pediatrician. And I take care of children who largely live in Southeast Baltimore and are Latino children and immigrant families. And we certainly see the health effects of poor housing conditions. But we really struggle with how to advise families because the parents don't often have the status or familiarity enough with the system to advocate effectively for their families. families. That's a challenge faced by many, many families, but is exacerbated to some extent due to language barriers and then issues of documentation status. So just a question about, how we advocate on behalf of those families and how we bring them into some coalition with consideration that these children are not going anywhere. The children are citizens and are part of our community sort of now and into the future. And just sort of how to bring them into the fold to strengthen to add numbers to people requesting help.
You want to take that?
I think, first of all, thank you for being a doctor, and our goal is that you can write a script to clean up the house very soon, right? But it's trust that has to happen with that family to know that if we go in to do work with them, that they're not going to get evicted, they're not going to lose their home, and that they will be able to have the benefit of that. And actually, it's precluded by HUD funding. If you take HUD funding, that immigration status is protected, actually. Maybe I shouldn't say that loudly because I don't want anybody taking that away. But we have a number of members of our crew and on our staff who are bilingual and primarily grew up Spanish speakers. I think that's an important connection that has to happen, but there has to be trust. I will say that in our community, Baltimore is blessed with some of the best laws in protection against retaliatory eviction and protecting family status. And, but it takes a really good conversation in that connection because we will get referrals from doctors and people are afraid to utilize the services because they don't want to land up with the unintended consequences. And I think it's important on all of us to be at ground doing important education there.
Yeah, and let me just add, because really to the outreach piece, and I think there are a couple of ways to look at that. One of them is operational, and see our friend Reverend Hickman out here. Last night we were talking about community health workers. So I think as we expand those types of roles, and I'm from Texas originally, and so you talked about other models in those environments and communities, that we need to do more of that. And the other thing on the research side, both I know at Hopkins and at university, because we partner with university about patient care outcomes research activities. And those dollars are targeted to reach communities, African American, Hispanic, whatever the race or ethnicity, in order to help them figure out how to be better engaged in these kinds of initiatives that you're talking about. So I think plugging in both on the operational side as well as the clinical research side can be beneficial.
Wow. Alice, I want to kick it to you very briefly. We're talking about Southeast Baltimore again. How do we conceptualize bringing in all pieces of the community in dealing with this problem?
I think it involves members of the community across the board coming to the table, and to echo what Ruth Ann said, ensuring that everybody has a voice and that voice is respected and heard at the table in terms of looking at the different community groups. Baltimore is a city of over 225 neighborhoods, and of those 225 neighborhoods, often there are sub-community groups underneath the main community group, underneath the main one, and there's another fraction that breaks off over into the corner. And sometimes one of the challenges is trying to pull everybody together around the table to have an understanding that we need to respect each other. Everybody's going to have differing opinions, but we all have the same goal. We all want to have a Baltimore where everyone across the city can live in a healthy home with a vibrant community around them, with the ability to walk down the street and say hello to their neighbors and go to a corner store and get healthy food and walk to their neighborhood elementary school and receive a quality education and have the ability to catch on-time transportation to take them to a job. We all, across the board, no matter what neighborhood we come from, where we are in the city, have those goals and aspirations. And I think being able to come to the table and have those discussions in a respectful and open forum is extremely important to bridging any divides that might exist when you start to break neighborhoods into the separate little factions that occur in the neighborhood politics that come in the way. We are all one. We all believe, we We just are. We have the city of Baltimore. There are amazing things happening in the city right now. Amazing things that I think sometimes are overshadowed by some things that are happening that get more press than the amazing things that are happening. And we have the ability to kind of change that, and I think the time is now. And we are on a tipping point, and knowing what I know from the community members, and when I'm out in the community and working with the families that I get to see and interact with every day by trying to help them in this work, I think that we're going to be on the tipping point in the positive direction by pulling everything together and having the understanding that we together can make the change happen.
Again, wow. Well, I want to say thank you all for being here, and thank you all for coming out. This was great.